We are excited today to talk a little bit about homeless individuals and the impact of hepatitis C on that group. Homeless individuals face a lot of challenges, including healthcare and healthcare access challenges. And hepatitis C rates, as we discussed earlier, as many as half of people who are homeless have chronic hepatitis C. And I think it's, we haven't developed the tools that we need to help this population as much as we could. However, it seems to me that the folks that are going to talk about it today, Kailyn and Earl Batte, have been doing some really excellent work that's going to help all of us to understand. I did just want to kind of reflect that in talking with the folks that are here joining us today and on the next webinar, I heard stories of people who were very close to losing their home, were not able to sustain an apartment or a place to live, maybe lived out of their car for a little while. And I think many people are in a position where they're just one or two paychecks away from being homeless. So it's not uncommon for people to be in a unstable housing situation or to become homeless, at least temporarily and sometimes long term. So it's an important population. They face a lot of challenges, and really, really happy. I want to welcome Kailyn. I think she'll probably kick this off from the Los Angeles Christian Health Centers, their Midnight Mission clinic, where she works as a care coordinator. Kailyn, are you there?
Yeah, thank you guys for having us. So my role in treatment is kind of diverse because with Hep C, and particularly with the homeless individual, each person's case can just vary so much. So sometimes they need help with figuring out next steps to get labs done. Some aren't sure if treatment is even something they want. And all of them need monitoring during treatment. So for each patient, you're really trying to meet them where they are and to kind of show them what their next step is. And so Shannon Fernando, our associate clinical director, is running a program in our Midnight Mission clinic in which people living at the mission, trying to recover from substance abuse and homelessness, can be treated for hepatitis C, but with some of those extra barriers out of the way. For homeless individuals, even having a place to store their medicine can be a challenge, but this setup addresses many of those issues in a really unique way. Patients are living in the same place that they're being treated, so they have some extra stability, they have a safe place to live, and they have the benefit of only having to take a flight of stairs down to come to the clinic. One barrier I have seen, though, stems from the clinical presentation of Hep C. Since it's possible to go for years without any symptoms or pain, it is often lower on the list of priorities for both the healthcare providers and for the patients that we're seeing. And this is especially true for the homeless population, where our patients tend to have really long medical problem lists. Without serious symptoms, Hep C can go for the most part ignored, even though the virus is silently destroying a patient's liver, and even though Hep C can be life-threatening. I recently saw a patient who told me, thank you for coming in to speak with me today. I totally would have forgotten that I had Hep C when I came in to see the doctor today, but he just told me how much he wanted the treatment and how the treatment was going to be part of his recovery, how he considered Hep C treatment part of his recovery from drug abuse. So I think that that's one thing that is so significant about Hep C treatment. It's the fact that it can give these patients hope not only for a future in which they're free of just the virus, but also a hope for a different future period. There are so many patients for whom treatment becomes a source of motivation and a source of empowerment to change their lives, or they see it as part of a life change that they're already making for sobriety or for something else. I think that that's a really special thing about Hep C treatment. It can save someone's life, not only so that they can live longer, but it also gives them a chance to have a completely different future. And one more thing I will say is just how much that I love working with Hep C patients. I think it's really important to know that they're a group of people who really want to be cured, and they really want to move forward in their lives. Like, they're not getting treated just because they're in pain all the time and they just want the pain to go away. They could have ignored a disease that doesn't give them any pain, but instead they're really thinking about the kind of future and the kind of health that they want to have. And that really shows in their treatment and just the way that they really make an effort to make things happen and make their treatment a success. And that's really something that's exciting to watch and something that's exciting to be a part of. And yeah, it's just amazing to be part of these patients' lives in that way. And then I have with me one of our patients, Earl Batte, who wanted to say something too. So, Earl?
Yes, my name is Earl Batte, and I thank you for the opportunity to share a little bit about me. I consider Hep C extremely, extremely dangerous virus. I'm not sure how many years that I was in my body, but I had no symptoms. And that was part of the major problem because I didn't have any symptoms that deterred me at all. And when I found out about the treatment, I was hesitant about it because it wasn't on my priority list. I had received treatment before with interferon and a ribavirin, and the side effects were so horrific, it scared me in not wanting to get the treatment. And part of the problem with that was there wasn't any symptoms of the hepatitis, Hep C virus. So I was really hesitant about receiving treatment. I did go through the treatment with ribavirin and interferon, and it didn't have effect. It was non-effective. Thank God that I did run into Shannon, and the Christian Health Center had the Midnight Mission, because for 6 or 7 years I thought the Hep C virus was out of my body. And when the thoroughness of Shannon and the participants here at the Christian Health Center and Midnight Mission let me know that the virus was still active in my system, it really scared me. When I thought I was cured of the Hep C virus, it was like uplifting to me. It gave me a new lease on life. I could have relationships. I didn't have to worry about my life being shortened. And then to find out that the virus was still active in my system was really depressing. I went through a period of depression all along while I was getting a thorough examination and having labs done and blood work done to determine what type of treatment would be administered to me. And it wasn't guaranteed at that. But the staff here fought for me and got my medicine approved. And so far, after having lab work, it's saying that the virus is out of my system. It's like a relief. It's like a million-ton rock being lifted off me. It helps me focus on the future and what I want to do with myself, because in the back of your mind is always that thought that your life can be shortened by a virus that you have. Or you could be crippled, or you could be laid up, or some type of other effect because of Hep C virus. It's such a scary thing because there's no symptoms, there's no indication that your body or your liver is deteriorating, and you will have eventually a serious, serious problem that would be life-threatening to you. So I want to give all the props in the world to having had the being diagnosed with the Hep C and receiving the treatment. Thank you.
Earl and Kailyn, thank you so much for being here today. And, I think that oftentimes when we look at people who are homeless, people who inject drugs, or people who are in any way different from us, oftentimes we kind of other them. And we think of them as not equal, as different, and sometimes, unfortunately, look down on them. And I think you've kind of demonstrated that we shouldn't be doing that. And I have to say, in my own work in HIV, hepatitis, I've come across people from all different walks of life that if I didn't do this work, I probably would not have had the privilege of knowing. And I have to say that we know people who are homeless can take their medications for hepatitis, for HIV, and do really well, and have lots of attributes and strengths to build upon. And so a lot of times it's really just kind of giving them the opportunity to have the space, the skills, and the time to do the stuff that they need to do to make things right in their own lives. So thank you for being here.
Thank you so much for doing this webinar. I think it's so important just to raise awareness, and just because it is something that goes under the radar so often. So thank you both.
And to you as well. Have a good one.
Thanks so much.